You're on.
Hi everyone, welcome back to Shannon and Veronica Know Everything. Today we're going to be going over disorders of the penis and urethra. So to begin with, we're going to start with peyronie's. So you can consider this like a broken penis because it occurs while the penis is erect. Typically, like during sex, the individual could bend the penis against their partner or in some other form. And so you can see here that this penis is bent, and so it's going to show up bent while erect. And so what happens is you create scar tissue in that damaged area. So as far as treatment, watchful waiting, so it's going to become very bad and then get to its best point between 12 and 18 months. This is very dependent person to person, so there are individuals who this will occur and they'll like it. It may feel better for their partner, doesn't really bother them. There are other individuals where it could cause a major problem. At that point, they can go ahead and do surgery. But surgery will decrease the length of the actual penis while erect. So the next one is a phimosis. So if you look at this penis here, you can see that it has foreskin and it's unable to be retracted. So that's what phimosis is. It could be either congenital or chronic infection. So if it's due to infection, you can go ahead and just treat it. If not, then you could do circumcision with the option for that. As far as a paraphimosis, so this is where the foreskin has been retracted. Typically, it's due like in the hospital where an individual is cathing and they don't replace the foreskin. Maybe a patient's trying to clean themselves and they don't replace the foreskin, so therefore it becomes inflamed and it's very difficult to push back down. This is where you as a provider will have to do that. So it's typically done at the bedside. You just grab it and you just try to pop it back out. The next one is a hypospadias. So this is where the urethra does not come out at the tip of the penis. So it's coming out on the ventral side. So this is your urethra here, and you can see that he's urinating through that hole rather than up through the penile meatus should be. So what happens is this can be due to estrogen or progesterone that was given during pregnancy, and therefore the child was born with this hypospadias. You do not want to circumcise the children who have a hypospadias. The reason why is that it can't be fixed, and they usually use the foreskin to do that fixture. So you do not want to circumcise without referring to urology and kind of seeing where you want to go for with this type of procedure. There's also an epispadias, which is on the dorsal side, but it is very, very rare, so we don't really talk about it much. The next one is a penile Lynchian sclerosis. So you're going to see that it's on the skin and it becomes whitening, typically around the glands. It can also occur on the shaft of the penis. And this is something that you can actually see in the vagina as well, but not as often. So with these individuals, you want to just refer them to derm. It is a severe chronic inflammatory lesion, so derm will take care of that, prescribe them some meds to get that taken care of. So now we're going to move over to a urethral caruncle. So this is the vagina, and then this red lesion. It's a red beefy lesion that occurs, and it's typically in menopausal women. It may be painful, and it could possibly be bleeding as well. As far as treatment, you're just going to prescribe a topical estrogen. Typically that will help. If not, you can go ahead and refer them to surgery and they'll just remove that. The next one is a urethral stricture. So this is acquired and it's due to infection or trauma. And it's just a fibrotic narrowing of the urethra. So these individuals could have a split flow stream, they could have retention, other symptoms as well. As far as treatment, there's 3 different ones. So dilation is one, but it's really painful and it's not permanent, so it's not always the best choice. The next one is a DVIU, so this is a good option if you have a small stricture. The following would be a urethroplasty. So this is a complicated procedure, but it is the most effective option for your patient. So that's of course something that you would discuss with your patient and decide with them alongside. So that goes over all of our disorders of the penis and urethra, so thanks for tuning in today.